Hi everyone, I am Adela Acedo, and in this video, we are going to talk about the congenital heart defect that commonly occurs in preterm infant, and that is persistent patent ductus arteriosus, aka PDA. But before I proceed, here's our objective first, and you can just pause this video to read it. Now, let's have a review on how does the blood flows in a normal heart, so that later we can understand and appreciate our main topic for today. Here is the pathway of blood flows through the heart. Oxygen poor blood from your body returns to the right atrium of the heart, and blood from your upper body returns through the superior vena cava, and blood from the lower body returns through the inferior vena cava. And as the right atrium is filled with blood, it contracts. The tricuspid valve opens and blood is pumped into the right ventricle of your heart. When the right ventricle is full, the tricuspid valve closes to prevent blood from flowing back into the atrium. The right ventricle contracts and pulmonary valve opens, and blood is pumped into the pulmonary artery and to your lungs. The pulmonary valve closes to prevent blood from flowing back into the ventricle, and oxygen-rich blood from the lungs returns to the left atrium of the heart. As the left atrium is filled with blood, it contracts, and the mitral valve opens and blood is pumped into the left ventricle of your heart. This occurs at the same time as the right atrium pumps blood into the right ventricle on the other side of the heart. And as the left ventricle is full, the mitral valve closes. The aortic valve opens and the left ventricle contracts, and oxygen-rich blood is pumped into the aorta to reach all parts of your body. This happens at the same time as the right ventricle pumps blood into the pulmonary artery on the other side of the heart. And the aortic valve quickly closes to prevent blood from flowing back to the heart. Meanwhile, the atria had filled with blood and the cycle repeats itself. That's how the blood flows in the normal heart, but it's different in the fetus when it's still in the womb of the mother. The specific structures associated with fetal circulation include the placenta, the umbilical vein, the ductus venosus, the foramen oval, the ductus arteriosus, and the umbilical arteries. Blood rich in nutrients and the oxygen supplied via the placenta flows through the umbilical vein to the ductus venosus. Blood flows from the ductus venosus into the inferior vena cava up to the right atrium. This blood mixes with blood returning to the heart from the upper body via the superior vena cava and from the lower body via the inferior vena cava. And once in the right atrium, some of the blood flows to the right ventricle and some of the blood flows through the foramen oval to the left atrium and into the left ventricle, where it is then pumped out into the aorta and to the body. Blood that flows into the right ventricle is then pumped into the pulmonary artery. Because the lungs are fluid-filled instead of air-filled, the vessels in the lungs are narrow, creating higher resistance to blood flow into the lungs. Due to this high resistance to blood flow in the pulmonary circulation and the low resistance to blood flow in the systemic circulation, blood pumped into the pulmonary artery by the right ventricle is more likely to flow into the ductus arteriosus and then into the aorta. Due to the high blood flow from the superior vena cava and the inferior vena cava up to the right atrium, pressures in the right atrium are higher than the left atrium. This promotes blood flow through the foramen oval. And at the atrial level, only 8% of right ventricular output flows into the lungs, providing nutrients for the developing lung tissue. Most of the blood passes through the ductus arteriosus into the aorta and out to the body. And the umbilical arteries allow blood to flow from the body back to the placenta to be enriched with oxygen and nutrients. After birth, several changes occur as the fetal circulation adapts to the newborn's transition to breathing air. The ductus venosus and ductus arteriosus begin to close shortly after birth. The foramen oval gradually closes, allowing the left and right atria to function as separate chambers. The lungs expand and start to function, allowing the newborn to oxygenate blood through breathing. Now remember, the ductus arteriosus is supposed to close after birth, but in some cases it remains open. This is what we call persistent patent ductus arteriosus, aka PDA. Patent means open, and persistent meaning the open ductus arteriosus continues to exist. It is more common in preterm infants. PDA results in abnormal blood flow between the aorta and the pulmonary artery. It allows blood to flow from the aorta, which carries oxygen-rich blood from the heart to the body, into the pulmonary artery, which carries oxygen-poor blood from the heart to the lungs. This results in excess blood flow to the lungs and can lead to complications, such as pulmonary overcirculation. The increased blood flow to the lungs can lead to congestion, fluid accumulation, and eventually pulmonary hypertension. It is a high blood pressure in the lungs. Left to right shunting. Because oxygen-rich blood from the aorta flows back into the pulmonary artery, it can mix with oxygen-poor blood and decreases the overall oxygen content of the blood circulating to the body. This can lead to symptoms such as shortness of breath, fatigue, and poor growth in infants. Heart failure. The increased workload on the heart due to the abnormal blood flow can eventually lead to heart failure, where the heart is unable to pump blood effectively to meet the body's needs. Infective endocarditis. The abnormal blood flow through the PDA can increase the risk of bacterial infection of the heart's inner lining or the endocardium. While PDA is more prevalent in preterm infants due to the immaturity of their cardiovascular system, not every preterm baby will develop this condition. Various factors, including gestational age, birth weight, and overall health, can influence the likelihood of PDA development in preterm infants. The exact causes of congenital heart defects are unclear, but there are risk factors for patent ductus arteriosus or PDA, and these include premature birth. Patent ductus arteriosus or PDA occurs more commonly in babies who are born too early than in babies who are born full term. Family history and other genetic conditions. A family history of heart problems present at birth may increase the risk for a PDA. Babies born with an extra 21st chromosome, a condition called Down syndrome, also more likely to have this condition. German measles during pregnancy. Having German measles, also called rubella, during pregnancy can cause problems in a baby's heart development. A blood test done before pregnancy can determine if you're immune to rubella, and a vaccine is available for those who aren't immune. Being female, PDA is twice as common in girls. High levels of prostaglandins can also contribute to the persistence of PDA in premature babies. In fetal circulation, prostaglandins play a role in keeping the ductus arteriosus open, allowing blood to bypass the non-functional fetal lungs. After birth, the increase in oxygen levels normally triggers a decrease in prostaglandin levels, which helps initiate the closure of the ductus arteriosus. However, in premature infants, especially those born before the normal closure of the DA occurs or the ductus arteriosus occurs, high levels of prostaglandins may persist or even increase, interfering with the normal closure process and contributing to the persistence of PDA. PDA symptoms vary according to patent ductus arteriosus types. Small PDAs may not cause any symptoms other than a heart murmur. Larger PDAs may cause rapid breathing, shortness of breath or dyspnea, sweating during feedings, fatigue or tiredness, feeding and eating problems, poor weight gain or growth, and fast pulse or heart rate. If your healthcare provider suspects PDA, they may recommend referral to a specialist like a pediatric cardiologist. The pediatric cardiologist may order certain tests like chest X-ray, echocardiogram or heart ultrasound, and electrocardiogram or EKG. Healthcare providers may treat patent ductus arteriosus with medication, including non-steroidal anti-inflammatory drugs or NSAIDs. Medications may encourage patent ductus arteriosus closure, such as indomethacin injection. It is used to treat PDA in premature infants and who weigh between 500 and 1,750 grams. Indomethacin works by inhibiting the production of prostaglandins. Healthcare providers may treat PDA with surgical procedures too. Here are examples of a nursing diagnosis for PDA patients. Ineffective cardiac tissue perfusion related to altered blood flow secondary to PDA, impaired gas exchange related to pulmonary congestion caused by increased blood flow through the lungs, and risk for infection related to invasive procedures or prolonged hospitalization. As a nurse, the assessment should focus on activity and rest. The nurse should assess for weakness, fatigue, dizziness, a sense of pulsing, and even sleep disorders. Circulation. Circulatory assessment should include history trigger conditions, history of heart murmurs and palpitations, BP, and pulse pressure. Food and fluids. The nurse should assess for dysphagia and changes in body weight. Patent ductus arteriosus necessitates careful monitoring, patient and family teaching, and emotional support. And as a nurse, here are the interventions we can do to provide care for a PDA patient. Signs and symptoms. Watch carefully for signs of PDA in premature infants. Monitoring. Frequently assess vital signs, ECG, electrolyte levels, and intake and output. Adverse effects of indomethacin. If the infant receives indomethacin for ductus closure, watch for possible adverse effects such as diarrhea, jaundice, bleeding, and renal dysfunction. Preoperative instructions. Before surgery, carefully explain all treatments and tests to parents, including the child, and tell them about expected IV lines, monitoring equipment, and post-operative procedures. There is no known prevention for PDA. However, it's important to do everything possible to have a healthy pregnancy. So here are some of the basics. Seek early prenatal care even before you're pregnant, and quit smoking and alcohol, reducing your stress, and stopping birth control. Eat a healthy diet. Include a vitamin supplement that contains folic acid, taking 400 micrograms of folic acid daily before and during pregnancy. Exercise regularly. Get recommended vaccines, and control your blood sugar. Now you just finished watching the video, and which is great. I hope you find it informative and learned something new. To see how much you've learned, I have a short quiz on PDA for you. Take the quiz and let me know how you do. What is ductus arteriosus? A. A vessel that connects the pulmonary vein and aorta. B. A vessel that connects the pulmonary artery and aorta. C. A vessel that connects the right and left atria. D. A vessel that connects the umbilical vein and inferior vena cava. Which statement is true about PDA? A. The vessel connecting the aorta and pulmonary vein has closed prematurely, which is leading to increased blood flow to the lungs. B. The vessel connecting the aorta and pulmonary vein has failed to close at birth, which is leading to a right to left shunt of blood. C. The vessel connecting the aorta and pulmonary artery has failed to close at birth, which is leading to a left to right shunt of blood. Which is not a complication of PDA? A. Heart failure. B. Infection. C. Lung cancer. D. Pulmonary hypertension. Patency of the ductus arteriosus can be artificially prolonged after birth by administration of A. Glucocorticoids. B. Insulin. C. Indomethacin. D. Prostaglandin. Which of the following sounds should the nurse expect to hear when auscultating the second left intercostal space close to the upper sternal border of a patient with patent ductus arteriosus? A. Continuous machinery-like murmur. B. Systolic ejection murmur. C. Diastolic rumble. D. Spit S2 heart sound.